Bones. So somehow we tend not to think about them until something goes wrong with either our bones or the muscles, the ligaments, or tendons around them. Some parts of our bone health we really can't control well. When it comes to genes, you get what you get. But much of our bone health we can have an impact in. As we pass about age 30, we no longer add to our bone stores. Instead, we start losing bone. So bone health is important in two different phases. When we're young, we want to make sure that we can make our bones as strong as possible. And when we are older, we want to keep them as strong as possible. So how do we do that? First of all, weight-bearing exercise makes a big difference in how strong our bones are. Every day, small parts of our bones are breaking down and rebuilding. When we put stress on our bones, it rebuilds stronger to support that stress. So if you exercise and put weight on your bones, you are making stronger bones. If you're sedentary and not moving around much, not exercising, you're missing that stress and then your bones become weaker. Next, we want to choose a healthy diet that supports building that bone. We all know about calcium, but did you know there are over 20 different nutrients that are directly or indirectly related to bone health? So rather than simply taking a calcium supplement, we need to get all of those nutrients that are related to our bone health into our diet. So calcium, magnesium, phosphorus, protein, potassium, vitamin C, D, K, E, the B vitamins, as well as several minerals that we need in smaller amounts like iron, manganese, zinc, copper, selenium, boron, silicone, and fluoride. You may think, I don't even know what foods those are in. How am I going to get them in our diet, and how do I know that I get what I need? The short answer is it's really not as hard as you might think. We just need to make sure we're getting a wide variety of foods from different food groups so that we can meet those needs. You don't need to supplement all of these nutrients. You just need to be able to eat from that variety of foods. There may be circumstances where supplementing some nutrients, like for example vitamin D, may be important, but in general, you can get what you need from your foods. It's also a good idea to include probiotics in your diet too. There are some recent studies that have shown the benefit of probiotics to our bone health. Finally, think about some of your other health habits. Smoking reduces blood supply to your bone. It affects your ability to absorb calcium, meaning you get weaker bones, and it slows the production of those bone-forming cells. It also increases estrogen breakdown, and all of those factors lead to weaker, less healthy bones. Heavy alcohol use also decreases our bone density and weakens them. If we drink excessively, it can also lead to malnutrition, just not getting all of those nutrients into our diet, and that means you're not getting those nutrients that you need to build those bones. Bone health is important to everyone. It's especially important if you're having spine or orthopedic surgeries. So focusing on weight-bearing exercise, a well-balanced, varied diet, including plenty of calcium and vitamin D, and avoiding things like smoking and excessive alcohol can help you have better surgical outcomes and a healthier bone life.